Hi, my name's Lauren. I'm going to be your occupational therapist today. So I looked at your medical chart and I see that you're having some pain in your forearm after you took a fall and you hit your dresser just a couple days ago, right? So you
Yeah.
went to your doctor and he said that you had a mild contusion on your forearm. Is that right?
Yes.
How's your pain right now?
It's about a 6 or 7.
Okay, so we have something that's called a transcutaneous electrical nerve stimulation, or TENS unit. Okay, so what this does, it will help to control or manage some of that pain that you're having by sending some pulses or signals through your skin into the nerves that are in your forearm, and it'll help to gate that pain or control it from getting to your brain and telling you that you're painful or having pain. So, does this sound like something you'd be interested in doing?
Yeah.
Okay, so before we get started, I just want to do a couple of assessments to determine if this is, if you're a good candidate for this.
Okay.
So I'm going to start with asking a couple questions.
Okay.
So what'd you have for breakfast?
Waffles.
And do you know who the president is?
Obama.
And can you state your date of birth?
June 11th, 1993.
Okay, so now I'm just going to do a sensation test. Can you put your other hand up here for me? So I am going to just swipe your forearm, and I just want you to close your eyes and tell me if you feel it. Okay? Good. So now I'm going to compare this side to the other side. So I'm going to have you close your eyes again, and I just want you to tell me if they feel the same or different.
Okay.
Does this feel the same as this? Does this feel the same as this?
Yeah.
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 Awesome. And I'm just going to check your skin integrity. We're going to be placing electrodes on your arms, so we don't want to do that if you have any wounds or open cuts or anything like that. So your skin looks good. Okay. And are you taking any medications currently?
No.
All right, and then a couple more questions. Do you have a pacemaker?
No.
Are you pregnant?
No.
Do you have any history of unstable cardiac conditions, so heart attacks, arrhythmias?
No.
Any history of seizures or epilepsy? Do you have any tumors or malignancies in the area, or any undiagnosed pain? Do you have any decreased sensation or peripheral vascular disease that you're aware of? And when you're at home, because I'm going to be teaching you how to do this at home and by yourself, it's important to not do it over any central nervous system structures like your brain or spinal cord if you're having pain in your back, so just be aware of that. And you don't want to do it over your carotid sinus, so that's kind of in your front neck area, okay?
Okay.
Awesome. So I think that you would benefit from having this home TENS unit because it will help to decrease some of that pain and get you back to doing those functional tasks that your pain is kind of hindering you from doing, like picking up your daughter from the floor, or I know you like painting and it's really painful.
Yeah.
You also like gardening. So this is a benefit because you can use this on your arm while you're doing these activities to help decrease that pain and allow you to be more functional. There is one risk, however, and that is a little skin irritation, but we're going to teach you how to check your skin and monitor it, and if you have any issues with that, just give us a call and we will stop this treatment.
Okay.
And if at any time throughout this treatment that we do today you get uncomfortable, just let me know.
Okay.
And we'll stop, and here's a call bell that I'm going to give you. If I have to step away while this is on, you can let me know if you're uncomfortable.
Okay.
Awesome. So do you still think this is something you like to do?
Yeah.
Okay, so because your pain is more acute, so it's more of a current injury, we're going to be using a setting on this unit that's called the sensory setting.
Okay.
Okay, so first we're going to just take some rubbing alcohol and we're going to make sure that your skin is clean.
Okay.
And also, we just don't want to use this in more areas that have more hair. You can cut that down so that the stimulation can get through your skin easier. Okay, so while this is on, you should be feeling a strong but comfortable tingle.
Okay.
So can you point to me where you're having some of the most pain on your arm?
Right about here.
So when you're placing these electrodes, you're going to bracket the pain. So you're going to surround the area that is most painful.
Okay.
with the electrodes. The closer they are together, the more superficial the pulses are going to go,
Okay.
and the more further apart, the deeper. Okay, so we're just going to put them at least a pad's width apart.
Okay.
Okay. So the first setting that you're going to come across is up here in the top, and you're going to put it at 10's N.
Okay.
And then you're going to press set, and then you are going to get to rate, and this is going to be between 80 and 100. So we're going to go ahead and put it at 90,
Okay.
and then set. And the width is going to be between 50 and 100. So we're going to go ahead and put it at 80, and then press set. And then you're going to come down here to the bottom, and you have two choices, asymmetrical or symmetrical. We're going to choose the symmetrical so that it has even currents throughout, okay?
Okay.
And then while we're in the clinic, I'm going to put you on 15 minutes to try it out, but at home, there's no time limit to this. It's however long you want to do it throughout whatever activities that you want to do, but just be careful when you're using this at home and you're doing those functional activities that you're still aware that your arm is still in the acute stages of healing, and although this is decreasing your pain, we want to be aware that you're still injured, okay?
Right. Okay.
All right, so as I turn the intensity up with these plus and minus buttons over here, you should be feeling a strong, comfortable tingle, and I just want you to let me know when you feel that.
Okay.
You feel that?
Mm-hmm.
Are you okay?
Yeah.
So this is what it should feel like, and you would typically leave it on for 15 minutes.
Okay.
And when you're done, you are going to just decrease the intensity. So while this is on, we can also do some of those home exercises that we talked about. You can squeeze your putty, you can do your tendon glides, or you can be using it throughout your day.
Okay.
Alrighty, so when we turn this off, and when we do take these off, you're going to check your skin, and it is a little red, but that's completely normal like we talked about.
Okay.
Just make sure you're monitoring that yourself at home.
Okay.
And I'm going to give you a handout of all of the things that we talked about today, including all of the settings and stuff so that you aren't confused when you get home. How's your pain right now?
Good.
Awesome. So here's your handout.
Okay. Thank
And
you.
if you have any questions, just let me know, okay?
Okay.
I'll see you next session.
All right.